Hello, everyone. It's Cate Stillman with yogahealer.com, and I have the honor of being here with Dr. Gary Kaplan, who's an osteopath and the founder of Kaplan Center for Integrative Medicine. I'm just going to say the website is kaplanclinic.com, and that's with a K. And Dr., should I call you Dr. Kaplan or should I call you Gary?
You actually, most of my patients call me Dr. Gary.
Okay, I'll call you Dr. Gary. I'm down with that. So Dr. Gary is the author of Total Recovery, a revolutionary new approach to breaking the cycle of pain and depression. What was really fascinating about your bio is this work that you've been doing in family medicine and pain medicine, chelation therapy, and and all of those things that have also given rise to your work in as a clinical associate professor, and the work that you're doing and the outreach that you're doing in terms of being appointed the U.S. Secretary of Health and Human Services in 2013, and just this more macro level impact that you're having with your work. So to me, it's very important to presence that you're not just a doctor, but you're actually influencing policy and seeing the bigger problems of society.
Yeah, I mean, the objective, look, treating one patient at a time is important, but the reality of the matter is we've really got some misunderstandings, specifically in the areas of chronic pain, chronic fatigue syndrome. We see these kids with pandas, but also in the area of depression and generalized anxiety disorder.
Wait, I missed it. We see these kids with what?
Pediatric autoimmune nervous system disorders.
Okay. Oh, that sounds horrible.
It is a complete nightmare, and I saw one this morning who came into my office completely manic. He's talking at 5,000 miles an hour. He's pacing up and down the room. He hasn't slept in 3 days. And
how old?
He was 20.
Okay.
The official definition of PANS is in these kids who are less than 12 years old. But the reality of the matter is we now know that it extends well into adulthood, and we're seeing people affected differently, but in their 20s and 30s. And all of this is mediated by the immune system and infections that have set off the immune system.
Yeah.
So it's a big topic. We can go that direction if you want.
Yeah, I think we should. Well, let's talk about like the big evil doers in this equation in terms of like culture and habits and technology, and like why are we all, like it seems like most people feel like, yeah, they're overscheduled, yeah, they're addicted to their phone, yeah, they need more sleep and they're wired and tired, and they kind of get it. And they kind of get where it's linked to the immune system, and they kind of get how it's linked to inflammation, and they kind of get that by the time it gets to an autoimmune diagnosis that it's scary and harder to reverse the stress pattern. But they don't really get it. So why don't you help us really get it?
So let's start off. So the first book I wrote was Total Recovery. That book was focused on the innate immune system. So the innate immune system is kind of our first responders. So you get sick, these guys swing into action, and what they do is they'll kill bugs, and they'll also start to repair the damage that's occurred. And specifically, we're focused on the brain. So think of them as being the guys who come in, they're the demolition crew, damage has been done, they have to come in now and tear down the walls that have been damaged and tear up the carpeting. But if the damage has been severe, so extended periods of high stress, so if you grew up in a very high stress environment in childhood, we know that actually damages nerve cells in the brain, and that sets off an inflammatory reaction in the brain. And how serious is that? It's serious enough that it increases your risk of autoimmune diseases, rheumatoid arthritis, Sjogren's disease, lupus, but it also increases your risk of heart disease, it increases your risk of obesity, it increases your risk of dying too soon, much earlier. So stress is a great big deal, and it's not just stress in childhood, though certainly that's a very big concern, but it's stress anytime. And there's a difference in stress, okay? Some stress causes growth, all right? And that's a good thing. So stress is actually necessary for us to grow and to be healthy. However, bad stress, and those are stresses for mostly which you feel helpless and hopeless. Stresses from which you feel you can't control, stresses that are really overwhelming you. And that stress actually causes inflammation in the brain. That sets off the innate immune system, those first responders. Now, when those first responders get kicked off a lot, what starts happening is you get a chronic inflammation going on in the brain. And now, as opposed to renovating that living room that was damaged by water, they're tearing up the dining room, they're tearing up the kitchen, and they're tearing up the rest of the house. So we've got to get some way to quiet them down in the process. Now, there's a couple of really magnificent ways to quiet down the innate immune system. Aside from treating the original problem, meditation, yoga, exercise, proper sleep. That's the basics. That's really where things have to start.
Right. The hardest things to do. Oh, I want to back up. So what are the first, how would someone know if there's inflammation in their brain?
So brain fog or inflammation in the brain feels like a lot of things. Fatigue, chronic pain, difficulty, focus, and concentration. You're not rested when you get up in the morning. Okay, low-grade headaches. So all of these things is actually manifestation. They're the symptoms of inflammation in the brain. Depression, anxiety. Those are evidence of inflammation in the brain. Sleep disorders, inflammation in the brain.
Okay,
All
that's super helpful.
Back and keep causing the inflammation to get worse. So if you're not sleeping, so let's talk about sleep for a second. Okay, sleep isn't a thing. Sleep is 4 things: stages 1, 2, 3, 4, and REM. Slow wave sleep, deep sleep, is essential because that's when the brain detoxifies. All right, so the brain needs deep sleep in order to get rid of all the metabolic byproducts that have built up during the day. And if you're not getting that, your brain actually remains swollen somewhat on a regular basis. REM sleep is necessary because we have to process a lot of emotional stuff, and that gets done during REM sleep. And what happens if you don't get REM sleep is you start getting psychotic during the day. So if I take you and I deprive you of REM sleep for a week, you'll be flat out psychotic. You'll have hallucinations, you'll go crazy. If I deprive you of slow wave sleep by taking you in a lab every time you go on a slow wave sleep on the EEG, I wake you up, you do that for a week, you'll have chronic pain.
Okay. What are I have so many questions. What happens before the hallucinations? Is there like auras or like what, because I'm just trying to help people see, like before it's like totally blown out, like what are the little warning signs where you know this person's on that track and you know that it's, say REM cycle.
It's not just REM cycle, it'll be total sleep. So as you start to get sleep deprived, defined as anything less than 6 hours a night, you actually, after about a week of that, your performance level is equivalent to that being drunk. Your reflexes are slower, your thinking is slower, you're moving.
But you don't know it, right? Isn't that like the funny thing? That's the kicker.
That's the kicker, is correct. Okay, but then the accident rates go up.
Yeah. I mean, that's where the Department of Transportation gets involved, right? With these sleep statistics, is they're like, hey, we have all these people that are sleep deprived and they're causing all these accidents and they seem like drunk drivers, but they're not.
So many moons ago, I actually sat on an NIH advisory panel, consensus conference, where we looked at the evidence for meditation and relaxation techniques for treatment of chronic pain and sleep disorders. And the reality of the matter is sleep disorders are probably killing about 10 to 20,000 people a year on the roads.
On the roads.
People fall asleep. People not being as quick as they need to be, as attentive as they need to be behind the wheel of a car. Yeah. So sleep is a really serious problem, and it's one it's epidemic in this country.
Yeah. Yeah. Amen. Okay. I wanted to insert that in Ayurvedic medicine, which is the medicine behind yoga and meditation, right, from India. There's something called mental and emotional ama, and then there's physical ama. And some of those early warning signs, like where you're waking up feeling like you're already behind.
Right.
Those are like those first. So what I just want to like bring it, like we've known about this for thousands of years. Like we've known about, like if you wake up feeling behind, there's something wrong, and it's lifestyle based.
That's exactly correct.
And there's also that whole process, right, of like whether you're looking at deep sleep and deep meditation have a lot of similar abilities to detoxify the mental and emotional buildup of just the activities, like just the thinking, the emotions, like all of the stuff that gets packed into our day. And if we don't process that, then in Ayurvedic language, it's becoming this ama, which is toxicity. So we haven't had these words for this inflammation in Ayurveda, but we do have very clear concepts that have pointed to the same exact.
So I'm trained as an acupuncturist, And the beauty about acupuncture is it talks about leaves and branches and trunks and roots. So where's your problem coming from at the basis? And actually, that's part of what drove my research looking at the immune system. Because the question was, what was common to all of these things? Because there's a lot of things that can create the problem. Infections, Lyme disease, chronic Epstein-Barr, toxins such as mold toxins, sleep deprivation, sleep disorders will create these problems with inflammation in the immune system. And so by understanding what it was that was setting off the immune system, chronic stress, that was giving me some insight as to how I could change my history, get better understanding as to what was going on with somebody, and be able to fix the problems more effectively. Because if your brain is all inflamed from an infection, it ain't going to help your sleep.
Right.
You have to figure out what all the factors are that are coming into play, and then go after each one individually. This is a very different model than you come in, you have a bug, we give you a prescription for the infection, you get all better, you go away.
Yeah.
Now we have to think in terms of diseases of chronic illness, diseases as a result of chronic stress in our society, diseases as a result of sleep deprivation, diseases as a result of all these different infections and toxins we now get exposed to.
Well, and where I go with it is like diseases of habits.
Yes.
Like our habits are creating the disease. It's not that by lowering our resilience, right, we become susceptible to all the things. And then we become susceptible to all the genetic programming where it malfunctions. But if we don't look at that level of like, if the habits that humans need to thrive are out of sync with our cultural habits, then we're going to get sick.
Correct. And we reward people who don't sleep in our society. So being able to get people to take the time to take care of themselves is somehow or another puts us less than, puts us not as good as the next person, which is crazy.
Crazy.
Taking care of ourselves should be the first, second, and third priorities, because then we're much more effective at everything else we want to do.
Right.
So guarding our sleep, making sure we're getting to bed at the same time every night, or approximately the same time every night, getting a good 7 to 8 hours of sleep a night. Part of what gets that done is making sure the room temperature is appropriate. And frankly, the room temperature needs to be about 68. Too warm a room will interfere with your sleep. Too cold a room will interfere with your sleep. But 68 degrees. You don't have to be exposed to 68 degrees. You can be out of the covers and you can be comfortable and warm, but the room itself needs to be about 68. Quiet and dark. Other things that need to be accomplished so that you're getting rid of all the excess noise in the environment and all the excess stimuli in the environment. So those basic things in order to help you get to sleep. Also not eating for at least 3 hours before you go to bed.
Amen to that. The book I wrote, Body Thrive On, the up-level your body and your life, right? Like habit number 1 is early or later dinner, because we often, when we're taking in information, it's in the daytime and we can look ahead to the rest of the day. And it's like, if we can just do that, we get tired more early, we'll sleep more deeply, we'll wake up feeling more rested because our digestive tract won't be overloaded.
And turn off
I want to go and turn off your electronics. Yes, put them to bed. They need to go to bed too to be refreshed for their next day. Right, and away from your bed. I want to go back to quiet and dark, because I was talking with a dentist, and we were talking about teeth grinding.
Mm-hmm.
And she threw out some stat, which I don't remember, on the percentage of people with teeth grinding that sleep next to a snorer.
Oh, that's interesting. I don't know that stat.
I don't either. And I stopped immediately, and I was like, my husband has been affecting my sleep. So I sent him to a sleep specialist, and they found that he has inflammation in his basically the back of his tonsils, and he has a deviated septum, so there's like bacteria. So they gave him a simple saline solution, basically like using the neti pot, and so he gargles and washes his nose, and like the sound of his snoring is like at least 3/4 less within a week.
Your life is better.
And my life is better, and now I'm aware that that he is causing my sleep issues. Right? And I'm just saying this because a lot of times we have to look at like, oh yeah, sure, I have a quiet and dark environment except for my husband snores, or except for this thing or that thing. And until we architect our environment to enable the habits that we want to have, we're fighting against our environment, which is way too big a fight.
That's absolutely correct. But let's back up on the snoring for a second. Let's talk about sleep apnea.
Okay.
5% of the population, 85% of people don't know they have it. It'll take 10 years off your life. Increased risk for hypertension, obesity, stroke,
What about Alzheimer's?
and Alzheimer's. Alzheimer's is probably a chronic neuroinflammatory disease.
Right.
Okay, operated by that innate immune system we talked about.
I've heard it called like the diabetes type 3, where
There
you
is
have
some type of Alzheimer's, which is a diabetes type 3, where the brain can't utilize blood sugar as well. We can actually treat that with intranasal insulin. Now, you can't just stick insulin up your nose because it has to go way up high into the cribriform plate where the nerves come down. So there's a special nebulizer that costs about $4,000 or $5,000 that you have to use for this.
Wow.
But using that nebulizer, you can actually get the insulin up high enough and be able to reverse, in some cases, Alzheimer's that's associated with the type 3 diabetes. It is not all Alzheimer's, it's a subtype, but there's actually very good research on it.
Okay, got it.
But let's talk about
sleep apnea.
I'm a big guy on sleep apnea, all right?
Yeah.
So simple questions that you can ask yourself, called an Epworth. You can look it up online.
It's called an app what?
Epworth, EPWORTH. It's an Epworth scale, okay? It's quick, simple questions. Do you get tired or doze off when sitting and reading? Sometimes, never, moderate amount of time, or all the time.
My husband always does. Check.
Do you get sleepy or doze off when sitting in a meeting or at a theater? Again, sometimes moderate. Do you get sleepy or doze off when sitting and talking to someone? I have done that because I have severe sleep apnea.
So you're like in the middle of a conversation and all of a sudden you're like gone.
Fighting to stay awake.
Okay, fighting to stay awake. That's what it feels like. Is like you're just, yeah, okay.
You get sleepy or doze off when you're driving at night and you come to a stop sign or a light.
Oh my God, that's so petrifying that's happening with.
Do you get sleepy or doze off after eating lunch, sitting quietly without alcohol? Simple questions. If you're answering a lot of the time yes to this stuff, you need to get checked for sleep apnea. And sleep apnea can be treated sometimes with surgery. Sometimes it can be treated with a dental appliance, and sometimes most of the time it's treated with called a CPAP, continuous positive airway pressure, which is a little mask that you wear over your face. It saves lives. And finding it can make the difference between you being in pain, being depressed, dying 10 years younger.
And the reason it's saving lives is because now you have a shot at REM sleep and the deeper sleep cycles.
Sleep apnea is you literally stop breathing at night.
Right.
Your oxygen levels plummet. Your whole system goes onto hyper alert with stress because you're not breathing. You don't have any oxygen. And this can happen multiple times a night. Normal sleep oxygen levels should be about 94%.
Yeah.
Okay. Mine were dropping as low as 69.
Oh. So then would you notice it in the day you're falling asleep in all these places or wanting to, would you also notice a lack of sleep? A lack of focus?
Absolutely. So for myself, I was sleeping 8, 9, 10 hours and never rested. I was falling asleep all day long and I snored quite heavily.
Yeah.
So it was my wife. I actually went and got tested the first time and they told me it was okay. And my wife said, no, it isn't. They're wrong. I went back and the new test showed that I had pretty severe sleep apnea.
And then did you get the CPAP?
Yes, I use it religiously. I take it with me literally everywhere. If I'm on a plane and I'm going overseas, I take it with me on the plane.
My brother-in-law has one and he was telling me the same thing. He was like, I check a bag.
Yep.
And I was like, okay, that just because, and I get it. And he's like, because when I didn't, the next day I felt so bad and I realized that I hadn't felt that bad in so long.
Right.
And that's part of the problem here with all of this stuff that we're talking about, chronic issues, is that the habits that we have are catching up with us slowly over time, but habits have a momentum in what is, it's like there's this saying in Ayurveda that taste is relative. Like a lot of people think that the foods they like, they need to eat because those are the foods they like. But if those foods are creating a disease pattern and they switch diets, if they've switched for long enough and they're feeling better, they now notice that they like the foods that are making them feel better. And so the relativity has shifted. And that's part of the problem, right? Is like when you start feeling out of focus and tired every day, that just becomes your baseline normal. And it's just what you know to be relative, because there's not that other sense of, oh my gosh, what would it be like to feel so much better?
It is the
Yeah.
overused analogy of the frog in boiling water.
Yeah.
So what we get used to things, and then if somebody objectively sits outside going, that's not normal. You shouldn't be tired all the time. You
Yeah.
shouldn't have trouble with focus and concentration and name recall, and you shouldn't be falling asleep everywhere. You shouldn't be able to read a book without falling asleep.
Yeah.
So we accept things as normal that aren't. And let me tell you one other thing about brain inflammation. We now have brand new data. This is hot off the press. If you have these beta and tau tangles in the brain that we've associated with Alzheimer's, okay, if you don't have inflammation, it doesn't matter how many beta and tau tangles you don't have Alzheimer's. If you do have inflammation, you have Alzheimer's. And so now there's this whole concept of microglial priming. Microglia are the innate immune system in the central nervous system. The microglial priming setting you up for long-term inflammation and long-term damage to your brain. So there's a lot.
So when you're talking about long-term damage, what is physically happening? Like how are the cells changing?
Brain cells die, your brain gets smaller.
And so you're no longer in regeneration. Like would they normally regenerate or?
Correct. You're in a non-regenerative mode. So meditation, acupuncture can actually stimulate regeneration of nerves and the brain. All right. Sleep can do the same thing. But in a chronic inflammatory process, you have neurodegenerative disease, meaning the nerves are dying off, and your brain is actually getting smaller. And we can measure that in MRIs.
Yeah. Oh my gosh. I hope everyone who's listening to this, like some of it might be like, oh my gosh, this is me. But some of it might just like be these little flags of like, I think this is my mother. Like, I think this is happening. And she has mentioned sleep apnea, but she doesn't have a CPAP machine. Like, we need to get oxygen into that woman's brain at 2 a.m. This is really important.
But I also want it to be not just their mothers and their fathers and their grandparents. I want it to be them.
Yeah.
The fact of the matter is the majority of people that I take care of are their teens, 20s, and 30s.
Yeah, so let's talk about the technology piece and the tech addiction and the Netflix series where like all of a sudden you're in a mode where someone's actually triggering you to keep watching, right? Netflix says their biggest competitor is sleep. Obviously, all these companies are doing the same thing, same sequence where cliffhanger, cliffhanger, cliffhanger. My daughter was asking me the other day why I don't read novels. And I was like, if I read a novel, I'll stay up till like 3 a.m. because they're written so well to be engaging that I just need to turn the page.
Start reading bad books. You'll fall asleep earlier.
There we go. So yeah, let's talk about what young people are up against.
Well, they're up against a lot of things. I mean, teenagers should be getting 9.5 to 10 hours of sleep a night. All right. How many teenagers get that?
And this is through the teen year. Like this is like is this through young adulthood? Is this also early 20s?
This is into the early 20s. Okay. And the new studies are suggesting that adolescence in males at least extends to 27. If we just look at brain. Okay.
Yep.
My wife, by the way, will argue that it extends far beyond 27, but that's a personal issue. So the habits, we have to be taking care of ourselves from the get-go. And the problem is when we're young, we have lots of resilience. We can put up with a lot of stuff. We can stress ourselves out. We can not sleep and think we're getting away with it, but we're not getting away with it. So we have to be exercising. We have to be sleeping. Meditation, you can't start early enough. We should be teaching meditation in the grade schools. We should be teaching yoga in the grade schools and developing as habits that people do every single day as part of their lifestyle. And that will change everything. So if it's the 20s and the 30 somethings, I have kids who are severely disabled. I had a kid in this morning who, severe manic episode. He's pacing the room. His parents have to keep an eye on him 24/7. Why has he got a severe manic episode? Because he has got an infection a week ago that tripped off this whole thing. We're now treating the infection, quieting down the brain.
What caused it?
In his particular case, a bug called Mycoplasma pneumoniae, and prior to that, Lyme disease.
Okay.
What this does is it trips off the acquired immune system, and now the body is attacking itself.
Right.
This is where we have an autoimmune system where the brain itself is under attack from antibodies tripped off by an infection.
Right. Okay.
the infection under control, and then we'll do things to quiet down his brain.
Yeah.
But the other thing I want to talk about for a second is belief systems. So I had a woman in the other day who I had on an antibiotic to treat her chronic Lyme disease, and she was getting sicker and sicker and sicker and sicker and sicker. And I looked at her and I said, it's time to come off this. But I didn't tell her that. Instead, what we did was a body regression technique, a type of hypnotherapy, and I got her to tell me that she needed to come off of it. Now, why did she need to tell me? Because as soon as she told me she needed to come off the medication, she went from literally in one of the rooms, it took 3 people to wake her up. She was so out of it. She was so dissociated is what she was.
Hmm.
And when I told her she could stop the medication, she literally opened her eyes, bounced off the table, and was back present in the room 100%. And she says to me, I thought I just had to put up with the abuse. And I said, abuse? Then we start talking about childhood, and then we start talking about what she was dealing with. As a child, she was abused by her father. And this belief system throughout her life has been that she just has to put up with abuse. And so she doesn't speak up and say no. She doesn't speak up and say enough. And so she gets into this really regressive, really dissociative mode when she starts feeling helpless and hopeless.
Hmm.
And as soon as you re-empower her, she wakes back up and becomes present again.
Hmm.
The other question then is, what are our belief systems that are driving our habits? What are our belief systems that are forming our lives? And most of them we're not even aware of. And that's what doing things like meditation, where you're really sitting and listening to yourself.
Yeah.
Here's what's going on, that you begin to understand how you can get better.
Yeah. I mean, it's fascinating having a lot of training in yoga and meditation and yoga philosophy, because when you look back at the texts from a couple thousand years ago, it was more or less about understanding when you're sitting. So yoga was more about the sitting practice 2,000 years ago. Like there was no postures associated with it. That came later. And so all the yoga sutras are really about you and your mind, like you and your consciousness, right? And so like the first ones are all about noticing the fluctuations, like noticing that who you are is not the words in your mind. It's not the auto replay. It's not the patterned mind. And then later in Yoga Sutras, you learn about discernment. Like you get to choose what you attune to, what you allow into the mind, and how you use your mind. And a lot of people don't understand that about meditation. They think it's about sitting and experiencing peace. They don't understand that it's actually, it's like, take back the night, like take back your mind.
Meditation is a pain in the ass, because meditation is sitting and being with what is and not judging it. And sometimes with what is painful.
Yeah.
Grief, fear, and it's about what else is there. And if I can plug 2 friends' books, Tara Brach has written a couple of brilliant books, a new one that's just come out. Radical Acceptance, though, is her first book, which I think is just flat out brilliant. Mm-hmm. And Liz Stanley, another colleague, has just written a book called Widen the Window. And both those books are really brilliant meditation book. Tara has a couple of other books as well, but really helpful for people. Liz did some brilliant work with the military where she was looking at resilience. And so she was looking at, if we teach people how to meditate, can we improve the areas of their brain where resilience seems to reside? And so what they did was they looked at these special forces guys, and they did functional MRIs and measured brain volumes, how much different areas of the brain were represented. And the insular cortex in particular showed up on these guys. So the question was, if we teach people how to meditate, a 10-week program, can we see changes in the same areas of the brain where the guys, the supermen, if you will, and women who are in our special forces, where their resilience is exceptionally high? Can we replicate that? And indeed, doing regular meditation improves the volume. It actually increases the size of the brain in those regions. And so doing that meditation on a regular basis, the opposite of inflammation is regeneration. And so what we see is growth of those brain areas with regular meditators. And we're looking at better decision-making. We're looking at better resilience, recovery from a trauma. And that's the kind of stuff that meditation can give you and is so important in our daily lives.
Yeah, amen. So the parallel between the sleep stages having this detoxifying effect, which is happening not with our consciousness, and then the meditation, which is where we actually can apply our consciousness to detoxify, to reduce inflammation, to stimulate regeneration. What I'd like to hear, I mean, because a lot of people are like, I can't meditate, right? Because they're so anxious, or they're so depressed, or they're, you know, I mean, if decision making is connected to the sleep cycle and connected to meditation, like they're not making good decisions. So where do you go?
So one of the areas is you can start simple. If there's a lot of anger, there's a lot of frustration, I have people spend 10 minutes yelling, shouting, screaming, beating pillows, being angry. But I want them in a place where they're safe. So I want them in their bedroom. I want them in a room where they can really let it out and not have to worry about saying anything. 10 minutes, yelling, shouting, screaming, beating pillows. And it's timed because it's a discipline.
Yeah.
After the 10 minutes, you sit down and you put your hands over your heart. You say, okay, heart, if you could speak to me, what would you say to me? And sit and listen. Now, what you may find is all kinds of stories start coming up. That's okay. When you find yourself telling those stories, just gently escort yourself back to your heart and say, okay, heart, if you could speak to me, what would you say to me? And maybe out of another 10 minutes that you're sitting listening to your heart, you'll get 10 seconds. Fine. Maybe next time you'll get 15 seconds. And just keep being present for that. Because what happens is when we're so angry, when we've got so much frustration built up, that's the first thing that starts coming up. We get antsy. We can't sit. We got to keep moving.
Yeah.
There's another simpler way to bring into this, a gentler way, which is doing, practicing gratitude. And this is a lovely time of year in particular to be doing that. And many times we'll begin staff meetings with everybody going around the table saying, I want 2 things that you're feeling most grateful for today. You may feel grateful for your son or daughter got a good grade. You may feel grateful for the fact that your parents are healthy. You may feel grateful simply for the fact that your back doesn't hurt today. Whatever it is, but you want to note it. You want to say it out loud. What are you grateful for today? Or write it down. 1 or 2 things. Keeping a gratitude diary is a lovely way to begin that process.
Yeah.
There's
Amen.
a lot to get into it.
Yeah, right. And as a practice, I'm trying to remember who wrote the gratitude journal. He's a monk, that guy. I'll find it, you guys, and I'll put it in the show notes.
Thich Nhat
Hanh. No, it's a different one. It's a different one, or at least the one I'm thinking of. I know there's probably. I'm gonna Google it. But what was so mind blowing about this guy's path when I recall it here is he would come up with 3 things a day before he'd go to sleep, and they would never be the same 3 things. And that, I mean, this was his spiritual path, right? And so what happened is he never ran out of things. Right? They became, and it makes so much sense from a yogic perspective, which is like when you tune in to the vibration of the universe, you will notice it expands. Like it goes to more. It doesn't go to a shrinking brain. It goes to a bigger brain. Like it goes to more opportunity. It goes to more possibility, right? It goes to more sensitivity so that you actually are able to notice more. So to me, it's just such a phenomenal as a practice, right? Where we can go just with shifting. And you were saying before, the belief, like if you have a belief that I'm hopeless, like if you have a belief that there's nothing I can do to change my situation, that's really different than being grateful for something. And then all of a sudden you notice you're much more empowered to change your situation.
No, you're absolutely correct. So building these habits that help us be healthy, changes us physiologically. They change our brains, they change our immune system, and they change our health. And as you say, then everything expands for the better. It's a bigger world. You have bigger opportunities. And a bigger future. And that's the kind of stuff that we're looking for. And one of the things I see in the people that I treat, as soon as they start to get better, the very first signs of them getting better, because I treat people who are very, very sick. I treat people with chronic Lyme, I treat people with chronic fatigue and chronic pain syndromes and severe depressions. And what we find is they start to get better, they start to have a thought about what the future is going to look like for them.
Yeah.
When we're really sick and we're really constricted, we lose all view of a future self.
Mm.
What about going back to school? What about going to graduate school? What kind of a job do I want to do? What kind of profession do I want to pursue? Do I want to think about having kids? Do I, all of a sudden, all those basic things start coming back into view. Next Friday, I think I'd like to get together with my friends. When you're really sick, all of that goes away.
Or tired, like we're now equating sick with tired. This is so
Absolutely.
important. Yeah.
Absolutely.
Yeah. And right. So I had created this course on the habits of yogis. I actually created it in 2000, and then it slowly grew from a 2-hour workshop to now it's a year-long course. All of our course members have to go into any other course, they have to go through at least a quarter of it. Earlier, lighter dinner, early to bed, start the day right, breath body practices, plant-based diet, and then going into the subtler ones of self-massage, which is so amazing for all hormones in the body to re-regulate, right? And other things about building confidence, and then the other habits of sitting in silence, of healthier eating guidelines, so people aren't just eating constantly throughout the day, but they let the rest and digest cycle, all the way to easeful living as a habit of like choosing your mindset, choosing ease over stress. So we train our members in there, because if they don't have these habits, we can't do higher level coursework.
Correct.
We can't do anything that involves business, that involves life purpose work, or deeper learning, in the particular ways that we teach it. It's like, and I just want to say, like, I came to this, Dr. Gary, not from understanding that, but just from trial and error with people, and realized that when we put people when we let them go into a higher level course without the basic daily habits established, they'd fail. They'd get overwhelmed. They'd create issues. They'd create drama. It just never worked. But when we change the cycle of like, nope, everybody, I don't care how long you've been meditating, I don't care if you've been teaching yoga for 30 years, we've got to make sure that all these habits are that you're attuned to all of them, not just like one, but not the others. And then all of a sudden we notice like everything works, everyone's chill, they can learn, they can go into life purpose work with a clear and focused mind. They can take action when frustrations arise. They can manage their frustration and realize that it's what you were talking about in the beginning, that it's part of a positive growth path that they're choosing now, because they have resilience. They're choosing certain levels and degrees of stress in order to grow.
No, you're absolutely correct. And on my end of the universe, it's about looking at the science that we're seeing real changes in how the brain functions in a positive direction. We're seeing real changes in the way the immune system functions in a positive direction. And not doing these things, we see detrimental problems with the brain and the immune system. So this is, from the get-go, what we all should be doing. This is the base. This is where it has to start. And after that, we can get into the fancier stuff.
I love it. I found the gratitude journal I was referencing to called May Cause Happiness, a gratitude journal by David Steindl-Rast, who's this. Yeah. Oh, amazing.
Brilliant.
So I have another question. I know I could talk to you all day, and I know you have other things to do besides to talk to me, but I'm wondering, because one of the things that you had mentioned in our notes was what really causes Lyme disease. And I want to know, because especially with the people that I've seen come into our community to learn about Ayurveda and to go on through our self-healing or Ayurvedic program, we've had people with chronic Lyme disease come in. So I'd love to hear what we don't know. So
the short answer on Lyme disease is, well, it's an epidemic. We're seeing over 300,000 new cases of Lyme disease a year, and about 10 to 20% of those people go on to chronic Lyme. The other thing about Lyme disease is it's not just Lyme disease. Ticks carry a bunch of different infections. So they carry Ehrlichia and Anaplasma, and they carry Bartonella, and they carry Babesia. So we have to make sure that we're looking at the full spectrum of potential diseases that you may have gotten infected with from a tick bite. In addition to that, tick bites interfere with the function of the immune system. So when we're going after ticks, the tick infections, we have to do several things. One is we know that the bug exists inside the cell, outside the cell. It exists in a cyst form, and it exists in a biofilm slow divider form. And thus we have to treat all four of those compartments in those forms in order for us to be successful at getting rid of tick-borne diseases. The very, very exciting news in tick-borne illness is it looks like we may finally be able to legitimately cure the 20% of people who've had the chronic tick-borne disease. It looks like two drugs in particular, dapsone and disulfiram, actually go after the slow dividing biofilm forms, which we believe, the persisters, which we believe have been responsible for the chronic disease. And so now that we have that in our toolkit, we're actually seeing people recover who are not getting better previously. And we believe that this recovery will actually be a cure, not just a temporary reprieve from the disease. So there's a lot of exciting things going on, but you also have to treat the immune system. So when the innate immune system's upregulated, you have to treat that to help calm that down. And there's a lot of things we can do in order to do that. We've already talked about the basics in terms of sleep and diet and whatnot. But we didn't talk much about diet, but that's a whole other topic. We also need to quiet the acquired immune system, and there are things we have to do in order to do that. But certainly in both cases, meditation is brilliant in terms of helping with both of those things. Exercise is brilliant at reducing inflammation of the body, but with people who have chronic fatigue, it's all about pacing, not pushing. So you have to always go up to the point, but not to the point where you crash. So we have to constantly be monitoring and making sure that we're not going too fast, too far. I had a kid who was only able to read, because reading is activity in the brain, right? He was only able to read for 5 minutes at a time when we started him out, because then he would literally crash for 2 hours, flat out exhausted, couldn't function. We gradually were able to increase his reading time. We treated him successfully. His case was actually mold toxins. And as we've treated him and gotten him better, he just completed his first semester at Baylor.
Wow.
So
his initial diagnosis was Lyme, and then it turned out to be until you treated the mold toxicity.
Mold toxicity, which was quite severe.
Wow. So just in terms of like the number of people get bit, that the number of people by tick-carrying Lyme's compared to the number of people that actually acquire Lyme's disease, is it the same, or is there a difference in terms of an already inflamed and already weakened immune system?
Well, if your immune system is already weakened and inflamed, you're more susceptible to everything. So that certainly becomes a problem. So if already you're not sleeping, if already our EDS crew seems to be, Ehlers-Danlos, the hypermobile. You ever been to a circus and watched contortionists?
Yes.
Okay, those people have EDS. It's a genetic disorder of their tendons and their ligaments, their connective tissue, and they stretch. Okay, the guys who are the real champs in yoga, they have EDS. They have hypermobility syndrome. And so EDS, you can tell if you can get your thumb back on your wrist without creating a great deal of pain. If you can put your hand flat on the table and lift your little finger up, straight up or a little bit beyond. If you can take your elbow and hyperextend it, or take your knees and hyperextend it, or if you can take your hands and put them flat on the floor without bending your knees, all of those things add up. If you get essentially 7 points, you're hypermobile.
Okay.
And that puts you possibly in an EDS category. So those people seem to have a greater susceptibility to developing chronic pain, chronic fatigue, and chronic Lyme. So without question,
that's interesting, just on the metaphorical front of being overextended, right?
Yes, well put.
Because in our Ayurveda, or actually in yoga therapy, we were trained how to work with hypermobility, and it was all about generating structure on the mat in their body. So you do exercises of like having their hands on the mat and having them squeeze their hands towards each other, in downward dog squeezing the inner edges of their feet and their shins, and it just builds a container of energy. And then eventually they get it that like, oh my gosh, this isn't just on the mat, this is everywhere in my life. Fantastic. Okay, thanks so much.
All right, I hope that's useful for you.
I think it will be. Yeah, appreciate it.
Okay.
Okay.
And again, I'd be glad to chat with you anytime.
Okay, fantastic. Thank you.
Okay, thank you. You have a good day.
You too. Bye.